This short presentation is going to explain the symptoms of urinary urgency and urinary urgency incontinence, sometimes called overactive bladder, and what you can do to help yourself to control these symptoms. So what is an overactive bladder? It's a condition that can result in the following symptoms: urinary urgency, where there is that overwhelming need to go and pass urine that cannot be put off; urgency incontinence, so there's an associated leak with the urgency; frequency, just needing to go to the toilet much more often than you're used to; nocturia, where your bladder wakes you at night time, maybe once, maybe more than once; nocturnal enuresis, bedwetting. So what causes an overactive bladder? It's often unknown, but this condition can be associated with various different risk factors that are all listed here on the right hand side, from neurological conditions such as multiple sclerosis, we have menopause, anxiety, diabetes, bad habits that develop over time, and other factors may be involved such as infections, bladder stones or tumours, uterine fibroids and constipation, where there is a pressure on the bladder that causes irritation. There are various different treatments for overactive bladder. Medications are sometimes prescribed to help to control the sense of urgency and reduce the associated incontinence. Lifestyle advice and bladder training will be discussed further in this presentation. Botox and certain types of nerve stimulation are reserved for those people whose symptoms cannot be managed by the above methods. Before we continue, it can be helpful to consider your anatomy and how your bladder works. This can give you a better understanding of how bladder training and other lifestyle advice can help. From the diagram on the right, you will see that we have two kidneys. These filter the blood to produce urine, which travels down the connecting tubes, called ureters, to be stored in the bladder. The bladder links to the outside via the urethra. The diagram on the right shows the bladder cycle, the sequence of events that occurs during bladder filling and emptying. Diagram 1 shows the bladder filling. The pelvic floor and the circular muscle around the urethra, the sphincter, contract or tighten to prevent leaks. Moving to diagram 2, we see that the bladder is starting to fill, and once it gets to about 200 milliliters, we would normally get the first sensation of needing to pass urine. We can normally put this off for a while until it's convenient time to go. At diagram 3, the bladder has filled further, and the sensation of needing to go gets stronger. At this point, we would go to the toilet, sit down, relax our pelvic floor muscles, and at the same time, the bladder muscle, the detrusor, contracts, and we pass water until the bladder is empty. At this point, we leave the toilet and the cycle starts all over again. Bladder training. This aims to reduce the frequency of toilet trips and enable us to get better control of the bladder and reduce leaks. It trains the bladder to hold more urine over a longer period of time by timing the intervals between toilet trips. The aim is to hold on a little longer each time to reduce the sensation of urgency and reduce the urinary leakage. It's important not to go just in case and to wait for your bladder to fill so that it sends you the message that you need to empty your bladder. It can take a while for this process to be effective. It's important not to give up and to persevere. The following tips will help you to control the sense of urgency when it strikes. It's important to try to stay calm and still rather than panicky and rushing to find a toilet. The sense of panic and the movement of your body are likely to increase the sense of urgency. When your pelvic floor muscles contract, it activates a reflex that helps to calm your bladder and reduce urgency. So try a long, slow contraction of your pelvic floor. Pressure on the perineum with your hand or a hard surface such as the arm of a chair can also result in a calming effect on your bladder. Some people find that going up onto tiptoes or to curling their toes helps to reduce the sense of urgency. And finally, distraction. Try to distract your mind away from your bladder by thinking about something else. Maybe challenge yourself to say the alphabet backwards or your 13 times tables to take your mind away from your bladder. You can help to chart your progress when bladder training by filling in a bladder diary, ideally for 3 days, such as the one that you can see here on the right. The diary will give you a clear record of your fluid intake, the frequency of toilet trips, the degree of urgency experienced, the volume of urine voided each time, and the incidence of urinary leakage. You can download a bladder diary at the BSUG website here in red, or you can find an app from the App Store, IUFlow, which will enable you to record your diary and email it to your physio or your doctor if required. Further advice. Good fluid intake is about 1.5 litres for most people. If you aren't drinking enough, it may result in more concentrated urine that may irritate your bladder and worsen your symptoms. Drinking too much will result in more frequent trips to the toilet and maybe disturb your sleep. If you are woken by your bladder at night, try to reduce late evening fluid intake, trying not to drink for the 3 hours before bedtime. And try to avoid bladder irritants such as caffeine found in tea, coffee, Coca-Cola, and fizzy drinks, as well as citrus drinks. Try to avoid constipation, as this can seriously impact upon your bladder function. Try to have good fluid intake and a varied diet. Seek help and further advice if you are still bothered by constipation. Aim to lose any extra weight that you may be carrying. Studies show that weight loss, when needed, can significantly improve your bladder symptoms. Stop smoking, as nicotine is also a bladder irritant. And don't forget regular pelvic floor muscle exercises, which can help to improve your bladder control and your pelvic health in general. In summary, remember your regular pelvic floor muscle exercises. Remember bladder training, defer the urgency, and wait a little longer between trips to the toilet. Consider completing a 3-day bladder diary to chart your progress. Drink sufficient fluids, avoid constipation, and take prescribed medication as directed by your doctor.